Theories of causation of the sudden infant death syndrome. That is, no one is sure why this it's okay, but there are several theories. Death may result from a number of causes which combine act by a common pathway of a cardiorespiratory failure, while the child is passing through a vulnerable period of development due to cardiorespiratory failure. Another theory is main theories are allergies from cow's milk protein, house mite allergy. Next is critical diaphragm failure, that is CDF, critical diaphragmatic failure, that is respiratory failure is caused by critical diaphragmatic failure. That is the four principal risk factors contributing to this critical diaphragmatic failure, that is underdeveloped respiratory muscles, non-lethal infections, prone resting position, and in an REM sleep. Even relatively minor infection can cause an acute and significant reduction in diaphragmatic force generation capacity than that in conjugation with other risk factors precipitate critical diaphragm failure. Next is the deficiency of some antibodies, biotins, calcium, magnesium, selenium, and hypogamma globulinemia deficiency of that, and some vitamins B, C, D, E vitamin deficiency, and also that during pregnancy certain factors were that inhibited the fetal circulation, that is the use of a cocaine use causes the fetal damage brain and medulla could not control breathing, and genetic factors like a brainstem abnormalities of the serotonergic system give rise to defective respiratory and autonomic responses. Next is cardiac channelopathies, that is the gene coding for faulty ion channels or ion channel associated proteins, long QT syndrome, short QT syndrome, Brugada syndrome, and catecholinergic polymorphic ventricular tachycardia, and faulty interleukin receptor antagonist, that is faulty interleukin receptor antagonist protein, that is interleukin receptor regulated receptor antagonists modulate a variety of interleukin 1 related to immune and inflammatory responses, and is encoded by interleukin regulated receptor antagonist gene. There are three known variants, that is allele 1 is normal, but allele 2 and 3 is increased risk of SIDS, and left ventricular hypertrabeculation. This condition is characterized by highly trabeculated spongy myocardium. Spongy myocardium causes heart failure, arrhythmia, thromboembolic events. A wide variety of mutations are responsible for the hypertrabeculation, and also the molecular MAO, molecular polymorphism, the hormones, that is deficiency of the parathyroid, and the parathyroid infections, respiratory infections, bacterial, staphylococcus aureus, viral infection. Next is the theory of causation is inflammatory reactions. That is in a small group of SIDS having high cytokine, that is interleukin 1 beta, interleukin 6 and TNF beta causes cytokine storm. Concentration are seen, the cytokine storm may be possible explanation for SIDS. And next is obstructions of the airways, that is any anatomical abnormalities, any nasal edema, nasal obstruction or inflection or both, excessive mucus in respiratory passes, and flaccid pharynx in a hypotonic babies, faulty neck posture also this faulty neck posture, and also the prone position sleeping will be increased risk of this SIDS, that is 3 times risk. The parents are now advised a supine sleep position for infants. Following factors may trigger death in this position: asphyxia due to asphyxia due to airway compression, rebreathing of the exhaled gases in the face down position, exhalation of this face down position of the gases, and impaired heat loss with a subsequent hyperthermia when the face is pressed against what when the face is the pressed against the bedding, impaired cardiorespiratory regulation related to the heat stress, and more bacterial overgrowth. There is a heavier growth of staphylococcus aureus and E. coli in the nasal swab, and also there is a heavier who sleep along their mouth compared with the babies who sleep on their back. And also next is the theory of causation is that is sharing of beds, parents and others the sharing. And the next is sleep apnea, that is prolonged sleep apnea in certain infants causes hypoxia and death of that infant is a higher risk for SIDS during sleeping reason is cord death or crib death. And sleep induced arrhythmia, that is, and also toxic, that is mattress related contain for phosphorus, arsenic, and cerebrin compounds are fire retardant. That they are fire retardants. What will they cause? They cause warmth and perspiration of the sleeping infant by infant, and infection by microorganisms, especially the fungus, that is Scopulariopsis berbicalis, that causes the growth of this viruses generating phosphines, arsines, and stibines. So, and this causes the death of the stibines from materials containing phosphorus and arsenic, and the CBN poisoning causes to death. And miscellaneous causes, that is adrenal insufficiency, the conduction system abnormal anomalies, deficient liver enzymes, and gastroesophageal reflexes causes the bradycardia, hypothermia, impaired glial neuronal interaction in the cardiorespiratory center in the medulla, cardiorespiratory center in the medulla, brainstem, stoppage of the heart and respiration, and metabolic disorders and neurogenic shocks, sodium overload in feeds, and suffocation by the bed clothes or pillows. These are the theory of causation of SIDS. Thank you.